Ladies and gentlemen, my esteemed listeners, and the fellow admirers of the wonders of science, today marks a very special day when we are going to celebrate life and legacy of a very iconic figure, Charles Darwin. And on this Darwin Day, we decided to call a cytogeneticist on our podcast, where we will delve more into chromosomes today. Our today's guest has done her PhD in applied biology from Jaslok Hospital and Research Center, wherein her topic really fascinated me, which was metabolomic study of chromosomally normal and abnormal embryos. So let's welcome Dr. Mansi. Thank you so much, Dr. Mansi, for joining us, for accepting our request and for your time. Thank you so much.
Thank you, Payal. Thank you for the wonderful introduction and thank you for having me as your guest.
My pleasure. So let's start with a topic that I have already introduced you to our audience. We are going to talk about what is the role of cytogenetics in diagnostic industry.
Cytogenetics is basically the study of chromosomes, including broken, missing, extra chromosomes, and changes in these chromosomes would indicate some genetic disease. So, chromosomes, as you know, these are made of proteins and DNA arranged into genes.
Yes.
So, this is the genetic material which is present in all our cells. And we have 23 pairs, that is 46 chromosomes.
Yes.
So of these 23 pairs, one is inherited from the mother, one comes from the father. So this is, you can say, is the material that we are inheriting from our parents.
Okay, so what are some very common chromosomal disorders that we see?
You must be aware, you must have seen children with Down syndrome,
Yes.
Patau syndrome, that is
Yeah.
trisomy 13, trisomy 18,
Yes.
or Klinefelter-Turner
Yeah.
syndrome.
Yeah.
So these are some very common chromosomal abnormalities that we come across.
So when you talk about Klinefelter's or Down syndrome disorders, I have come across people talking about, if you eat a certain food in your pregnancy, then you will see कि ऐसे बच्चे होते हैं अगर आप एक particular चीज़ खाते हो pregnancy में, और अगर बच्चा सर पे गिर जाता है, so उसे ये problem होती है. So I really want to know, is that really true? Is there any is it actually true कि कुछ खाने की वजह से हो सकता है pregnancy में?
So see, this is actually a myth, because these abnormalities could either be inherited, either मम्मी को है, पापा को है, किसी एक partner को है, तो that will pass on to the baby. Okay. या तो फिर ये de novo हो सकता है, मतलब जब gametogenesis है, मतलब जब बेबी का ग्रोथ हो रहा है, जब माइटोटिक मेयोटिक डिविजन्स में कोई एरर आता है, तो these could lead to these abnormalities. During pregnancy there are some risk factors, जैसे advanced age हो गया, या some environmental factors है, तो these could increase the risk. But there is no such thing like कि गिरने से
कुछ खाने से. ओके, सो प्रेगनेंसी में कुछ ऐसा वे है, कोई टेस्ट है कि ड्यूरिंग द प्रेगनेंसी आई विल कम टू नो दैट देयर माइट बी सम इशू इन द fetus?
Okay, so see, you must be aware that generally during pregnancy the doctors always suggest for these ultrasounds,
Yes.
the marker screening test. तो काफ़ी बार इनमें एक रिस्क आइडेंटिफाई होता है, से रिस्क फॉर ट्राइसोमी 21. ये सारे स्क्रीनिंग टेस्ट हैं, तो इसका कंफर्मेशन हम साइटोजेनेटिक्स से कर सकते हैं. तो जैसे अभी सीवीएस सैंपल हो गया, मतलब जो प्लेजेंटा पे विलाई टाइप के थ्रेड होते हैं, वो 11 to 14 वीक्स के बीच में ये सैंपल हम कलेक्ट कर सकते हैं. या 15 to 20 वीक्स के बीच में एमनियोटिक फ्लूइड, मतलब जो बेबी को फ्लूइड सराउंड करता है, ये सैंपल से हम karyotyping फिश कर सकते हैं. ये साइटोजेनेटिक टेस्ट हैं बेसिकली. तो इससे कंफर्म हो जाता है कि बेबी को ये अबनॉर्मलिटी है या नहीं है. तो इससे क्या होता है कि अभी जैसे जो स्क्रीनिंग टेस्ट हैं, दीज विल गिव यू फॉल्स पॉजिटिव, फॉल्स नेगेटिव रिजल्ट्स. तो जब हम कंफर्म करेंगे, तो इफ द बेबी इज नॉर्मल, यू नीड नॉट गो फॉर एन अबॉर्शन. Okay, and if there is an abnormality, you always have the choice of abortion. So this is the biggest advantage, and people should actually go for these tests once any risk is identified.
That means if it is detected in pregnancy itself, as you say, cytogenetics or karyotyping will confirm it. Right. So what if I know that yes, this thing is detected, this abnormality is there in the fetus? Is there a abortion legal in India when we talk about India?
Yes, definitely. So, we have a Medical Termination of Pregnancy Act 1971.
Okay.
And, now the up to 24 weeks of gestation, abortion
Okay.
is legal in India. And even post that, considering the situation, the pregnancy, how the pregnancy is, a decision can always be made.
So these tests are generally before 24 weeks of pregnancy?
Yes.
Okay. So that means it will be a little easier.
Yeah, like how I told you, CVS is generally between 11 to 14 weeks.
Yeah.
15 to 20 weeks is, when amniocentesis can be done.
Okay. And this amniocentesis, is this an invasive procedure?
You can call it minimally invasive. It
Okay.
does, carry some minimal risk of miscarriage.
Okay.
But when it is required, it is required.
But this is done only if there is a risk in the screening test.
Exactly.
Only
Not in all cases, but when screening or NIPT, if they identify some risk, high risk,
Yes.
then definitely they should go for these confirmatory tests.
Okay, that's great. So I think we all should be aware about this, right? During the
Definitely.
pregnancy, we have to do our marker test, and then if
Definitely.
our doctor suggests, we have to go for the cytogenetics.
Yes, so
test.
marker, ultrasound, NIPT, these should be followed routinely in all pregnancies.
Yes. Despite of all these tests, those are available during pregnancies. We have, the sonographies, the tests, the cytogenetics. Despite of this, we do see kids with these diseases.
Right.
So, if a kid is born with this disease, is there a test for the kid that we can confirm that what is the disease and is he carrying any particular disorder?
Like I told you, the screening tests, those are just screening tests which do give false positive, false negative. That could be one reason, that
Kids
babies
are born
with
with it.
these abnormalities are born.
Yeah.
Or maybe people are not aware, they're not going for these tests.
Yeah.
That could be another
Yes.
reason. So, there are many common traits, which parents or
Parents should look
pediatricians definitely know. So maybe you can say developmental delays, intellectual disabilities,
Maybe speech delays.
low
as
speech
well?
delays, low muscle tone, or short stature,
Okay.
low set years. So there are many
Okay.
such traits
Yes.
which will indicate that there's a possibility of an abnormality.
Okay.
Then definitely, once the baby is born, you can have the baby's blood and go for a karyotyping
Okay.
or a fish test. So this will, confirm the presence of an abnormality.
And for baby, what will be the sample then?
It will be a blood sample, peripheral
be a
blood
normal
and
blood
sodium
test.
heparin. Yes.
Okay, all right. So now we talked about during pregnancy itself we can do these tests. However, when I'm planning for my pregnancy, can we do some tests to check with my partner? Am I the carrier of this disorder? Is there anything like that?
Couples can always go for a couple karyotyping test. So there are
Okay.
many couples who have history of miscarriages,
Yeah.
repeated abortions, or they might have some abnormality in the family,
Yeah,
the
yes.
family history, or they are finding it difficult to get pregnant. So these couples definitely should go for a couple karyotyping test where you will test both the partners.
Okay.
So that will rule out the presence of any chromosomal abnormality. And in fact, these couples who have abortions, the abortus, that is the baby that has been aborted, should also be tested. So what happens then? You will come to know whether any genetic abnormality is the reason for the miscarriage. So this will help in understanding the future risk of miscarriage in the future
Yes.
pregnancies, or chances of an abnormal child being born.
Yes.
And in this POC, like POC is the product of conception, that is the abortus.
Abortus, yeah.
So if you find any abnormality, then maybe you can go back and test the couple.
Exactly.
And
Do the couple karyotyping.
Right,
as you
right.
said.
By couple karyotyping.
Yeah.
And this will help them also, to manage their pregnancy planning.
That's right. And so this is very fascinating, as in I really want to know when you said POC, product of conception, right? So if there is a abortus, how do we check that? It is an entire fetus that is being checked?
No, we cannot really accept an entire fetus. It is the part of the placenta, the villi that I had told you.
Yes, yes.
That is a sample which we collect,
Okay.
in sterile saline or sterile media.
Okay.
So, cytogenetics actually needs, sterility is very important. So, all samples should be collected under sterile conditions.
Yes. Okay. So all these tests which are available, if a parent knows that my kid has a particular chromosomal disorder, is there any treatment for these disorders then?
So you see, unfortunately, there is no treatment or cure because these are genetic. They are in all your cells, in the DNA itself. But you can always go for genetic counseling or occupational therapy, physical therapy. Certain medicines can be recommended. So basically, these are lifestyle management. You can say that we can do. So this will help the child or the person to at least have some independence in all the areas of their lives.
They can change their lifestyle accordingly. Once we know what is the issue, then we can act accordingly.
We can make their life better.
Make the changes, exactly. So that's very important. So you said that for a kid, if he or she is born with a disorder, it is just a normal blood test.
Yes.
So what are the samples for others, like when we talk about couple karyotyping, or specifically when we talk about pregnancy? Is that the villi that you spoke about, the placenta?
Yes. So for prenatal testing, we have the amniotic fluid, like I told you, it is the fluid which is surrounding the baby.
Yes.
Then we have the chorionic villus sample. That is thread-like structures in the placenta.
Okay.
So these are the samples which are required for prenatal testing, and like I told you, that sterility is important.
Yeah.
So 20 to 22 ml of your amniotic fluid in a sterile tube, or your 3 to 5 mg of your chorionic villus sample in a sterile saline or sterile media. And when you come to any postnatal testing, be it a baby or a couple, it's always peripheral blood in sodium heparin.
Okay.
And POC, I already told you, it is the a placental tissue in sterile saline or sterile media.
So these cytogenetic tests, there cannot be any chances of false negative or false positive. These are always confirmatory tests.
Yes, definitely.
So that's a
because, you are actually looking at the chromosomes.
Yeah.
So karyotyping and FISH, these are very basic and very common tests, and I can say that karyotyping, like I told you, it will give you information of all the chromosomes at once. It requires culturing and takes a little time, but all numerical or structural abnormalities of all the chromosomes, in fact, you will be able to visualize at once.
So we can visualize the entire set of chromosomes, and we will come to know whatever structural or numeric disorders are there.
And again, FISH, it's a very sensitive test, does not require culturing, and you get the results faster. But then it is very specific. If I'm suspecting some particular, maybe trisomy 21, I'll add the probe of the chromosome 21, so that will give me information only for chromosome 21.
Okay.
So, but it is more sensitive and more specific.
And culture is not required for
Culture is not required, and so it is not as time consuming. You get the results faster.
So your doctor may decide that if there is a if he or she suspects that there is a particular problem, then you can go for FISH. For specific
Otherwise, you always have a karyotyping test which will give you information of all the chromosomes.
That's great. So it is actually a real very big advantage of cytogenetics, right? We can rule out these false negative, false positive reports, because these are always confirmatory ones. And as you spoke about couple karyotyping, I think we all should go for it, specifically if we have someone in our family with these disorders. We have to do that, right? And in pregnancy, it is very important to check the risk of it, right? All right. So the other day I was also speaking with Dr. Mansi, and you told me about apart from all these things, apart from the embryos and the kids, there is a role of cytogenetics in cancer as well. So can you shed some light on it?
Yes, definitely. So cytogenetics actually plays a very crucial role in cancer. It helps in the diagnosis and management of various types of cancer.
Okay.
So basically, it will help you to identify favorable and unfavorable prognostic markers. It will help you to know the survival chances.
Okay.
And in fact, it will also help you to decide the best treatment for that patient.
Yes.
FISH, like I told you, it's very sensitive test. So FISH will help you, in case of bone marrow transplantation, where you can come, see, basically it will help you to know the engraftment or the remission status. So when I tell you this, what it simply means is, when you have a bone marrow transplantation, suppose that I want to know, whether the new normal cells, are they now, growing, and helping me in regaining my immune system.
Okay.
So that, and then you also want to know how much of cancer is left in the body.
Okay.
So
yes,
you will have these tests will always help you to know that.
Can we say that, so we know that in cancers we have screening test always, and then we go for biopsies.
Right.
Cytogenetics, can it replace biopsy?
So nothing can really be replaced, because everything, we always go stepwise.
Okay.
And when the bone marrow is the sample that we need, for karyotyping or fish.
Okay.
Or maybe you can have some tissues where
Okay.
we make blocks, and we have the
Yes.
So nothing can really be replaced. It's a stepwise procedure, but again here also cytogenetics is confirmatory.
Yeah.
It will help you to identify some specific changes or translocations or amplifications, deletions that have happened.
Yeah.
So then it becomes confirmed that this is the change that has happened.
Exactly.
So there are cases where I can say that this change is good. This change is bad prognosis.
Okay.
So that will help me decide the, maybe you can say the intensity.
Okay.
That will help me to decide the treatment course.
The exact treatment that has to be given.
Exactly. And in fact, even post therapy, fish can be applied to know the, minimal residual disease. So say before treatment, all 100 cells are showing abnormality.
Okay.
So post treatment, maybe I can do a fish to find out that what is the percentage of abnormal cells now post therapy. So that will help me to know what is the amount of residual disease, minimal residual disease. So this is how cytogenetic plays a very crucial role for cancer.
That's great. So that was indeed very, very important insight that we have got. So really thankful to you, doctor. We really understood a lot of things today. So we understood what is cytogenetics. We understood that we have cells, and in every cells in the nucleus we do have set pair of chromosomes, right?
Right.
And if there are any problem, maybe structural problems like insertions or deletions in the chromosome, or some numeric problems, then there might be some disorders that we call as chromosomal disorders.
Right.
We talked about some chromosomal disorders like Turner syndrome, Down syndrome, Klinefelter syndrome.
Right.
So these are the abnormalities that happens because of some changes that happens in the chromosome, to be speaking very normal simple language. Right. Then we understood that there are a lot of myths in India that we say if we eat something that your kid will have this disorder, or if अगर बच्चा गिर जाता है सर पे तो उसे ये हो जाएगा, which is actually not true. So these are again just these all things that happens because of the problems in your chromosomes, some changes that happens in your chromosomes. Pregnancy के दौरान क्या हम check कर सकते हैं is also what we understood. So we do have tests. We do the cytogenetics plays a really important role during pregnancy. Everyone should go for this test to check if we have a risk for this.
Definitely.
After pregnancy also, if there are continuous miscarriages, you can go for POC, as Dr. Mansi has told. That means it can be checked what was the problem with the fetus. Was it because of any chromosomal disorder? And couple karyotyping, I think this is a very important topic, right?
Yes.
Specifically, if I know that I have a person in my relative, in my family who has this problem, I should go with my partner before I plan for my pregnancy, before I'm pregnant, to check if I or my partner is a carrier for it.
Right.
If despite of all these things, if we do have kids in our family with these disorders, doctor has told us that there is no treatment. However, once we know, because there are tests that we can do on these kids, it's just normal blood test.
Right.
Once we know that there is a disorder, we can definitely take some steps for it. We can definitely change our lifestyles accordingly. We can do a lot of therapies for them.
Yes, definitely.
So that's very important. We talked about how these tests are done, the samples, like in pregnancy, what is it? The doctor has told us. For the POC, what it is. For kids, it is just a blood test. And a very important thing, we also spoke about the role of cytogenetics in cancer, right? That it is a confirmatory test for sure, and it will, what I really liked is in the cancer, it will decide what should be the exact treatment, is what cytogenetics will actually tell us. So, thank you so much for all these information. I hope this was really I tried to give this information in very simple language. From Dr. Mansi also has actually, I'm sure she tried कि बहुत simple language में सबको समझाया जाए. एंड शायद हमारे ऑडियंस को भी अभी पता है कि प्रेगनेंसी में ये चेक करना कितना इम्पोर्टेंट है.
yes.
अगर आपकी फैमिली में आपको पता है कि आपकी फैमिली में किसी को ये डिसऑर्डर्स है, तो आपको आपके पार्टनर्स के साथ बिफोर यू प्लान अ प्रेगनेंसी यू शुड गो एंड डू दिस टेस्ट. Thank you so much. On this Darwin's Day, we really came to know about chromosomes, cytogenetics, and what all possibilities are there.
Right.
Thank you again for accepting our invitation. Thank you.
Thank you, Payal. Thank you for giving me this opportunity, where I can, just talk about cytogenetics and make people aware
Yes.
of its importance. So thank you so much.
Thank you.
Thank you.